Cheers. And
Cheers.
welcome to Wine Wednesday. Did you know that even though you may have been diagnosed with arthritis, it can also affect your nerve function?
It certainly can.
Mm-hmm. Our nerves are supposed to move as if they are rubber bands, not as if they are rope or twine. They need that flexibility in the system in order for the appropriate nerve conduction to happen. And when someone has an arthritic joint and they're not having or getting that mobility that they normally would because of the arthritic joint, it can also affect the nerves and the nerves around that area because they are not able to move the way they used to be able to move. Anything you want to add?
Nope.
Before? And so today we're going to talk about the StimPod 460. And that is a device that is used to help with nerve function. It helps to promote that mobility of the nerve. It helps to promote the functioning of the nerve. And we have an example right here.
The StimPod is not an electrical stimulation device like we all know, but it does have electrical impulses. There is a pad that we use as a grounding pad, usually put it on the same side of whatever body part or region of the body we're trying to affect. So that's this lead. And then we have a probe that we use to try to localize peripheral nerves with. And then, of course, the device itself. So if, say, the knee joint is affected and I wanted to help to promote reconnection of the nerve that's signaling the pain and not moving as well as it should, as Tiffany alluded to, and help to restore its function, then I find the peripheral nerve on various spots of the knee with the probe, maintain contact with it, and it pulses an electrical impulse that travels not to its termination point. Let's just say we're talking about the sciatic nerve that terminates ultimately in the sole of the foot. It travels that way, but it also travels up the spinal cord and into the brain, so that effectively we're connecting the most distal or far away portion of the nerve to the brain. So we're re-engaging that nerve stimulus and the pathway so that the brain can tell the nerve to function appropriately when the joint is or is not moving.
Right. So the more you know about arthritis and different ways to deal with it, ask us a question. Give us a call. Cheers.
Cheers.